Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, we're doing another, I cannot speak. On this video, we're doing another Kahoot, and we're going to be covering patient positioning. So we're going to be talking about different positions depending on the patient's diagnosis or their surgery status. So this is a great video if you're at the end of the nursing program or you've graduated, you're studying this important base information that you need to know. If you just started the nursing program, this is what you're going to learn in your first to second semester in fundamentals of nursing. So this is a great topic for everyone that is taking nursing. Now, before we get started, as always, I'm going to ask you to please support me and support this channel. You can support me by giving me a thumbs up, liking this video. You're going to love it. So go ahead and press that like button now. Don't forget to check out my website, nexusnursinginstitute.com. So many great resources on my website. Be sure to check it out. Almost daily, you can find me covering, well, not so much this summer because I take the summers off, but I'm getting back into the swing of things. September, I'm back full time. Almost daily, you can find me covering a variety of nursing topics across my social media platforms: TikTok, Instagram, Facebook, YouTube. My handle is the same everywhere, Nexus Nursing. Be sure to check it out. Without any further ado, guys, let's get started. Okay, patient positioning. First question. Supine and the head of the bed elevated 40 to 60 degrees. What is this? Is it lithotomy position? Is it the prone position? Is it Sims position? Or is it Fowler's position? So the patient is lying supine and the head of the bed is elevated 45 to 60 degrees. What is the name of this position? The code is 318779. 318779. Thank you. Very good. Fowler's position. So let's talk about the other position, guys. Um, Lithotomy position. That's when that patient will be lying down on their back and their hips and their knees are going to be flexed. The legs are going to be separated. Sims position. That's when that patient is lying on their side. They're turned. Um, they're turned towards prone at like a 45-degree angle, but they're not prone. They're on their side between the side and prone position at 45-degree angle. And then last is prone. Prone is when you're lying down on your stomach, but your head is turned. So you're lying flat on your abdomen, but your head is turned to the side, okay? Okay, the bed is tilted so that the patient's head of the bed is down. What position is that? Is it lateral, high Fowler's, Trendelenburg, or prone? The bed's tilted so that the patient's head of the bed is down. Can you move the screen? Which way do you want me to move the screen? To the left? Like this? Very good. Trendelenburg position. That picture that you saw where the head was down and the body was up, that is Trendelenburg position. Now, let's talk about the other. I'm not going to say too much about the other positions because there are questions about them. However, I'll say this much. You have your lateral, that's also known as what? Side lying. Sideline position, where that patient's head, the shoulders, they're going to be aligned with the spine. And then you have high Fowler's position where that patient's basically sitting up. They're sitting at like a 90-degree angle. And last, I already told you what prone is. They're on their abdomen and head is turned to the side. All right, patient, what did I type? Oh, patient has burns to the face and head. I'm sorry. So you have a patient that has burns to their face and their head. How are you going to position them? Head of the bed elevated, head of the bed lowered. You're going to place the head in a flex position or you're going to extend the head. This patient has burns to the face and head. How are you going to position them? Congratulations, Jojo. Very good. Elevate the head of the bed. Why are we going to elevate the head of the bed? Well, I want you to think about what happens during a burn. When a patient has a burn, there are a couple things that are going to be a priority for you. Immediately, these are the first things that you're going to care about. You're going to care about infection. Why? Your first line of defense against infection is what? Your skin. If the patient has a burn, right, they have altered skin integrity. So we're going to be concerned about infection. We're going to be concerned about airway, and airway is actually going to come before infection. Why? They have a burn to the face and the head. Most likely, if they had a burn to the face and the head, they were breathing in that smoke. Guess what happens? Your airway closes up, right? So we're going to be concerned about that. We're going to be concerned about swelling because you know what happens. All of um, the albumin, which is a protein part of the blood, it leaks out, and so does all the fluid. So even though this patient's walking around looking like this, they're swollen. They're what? Dehydrated, which is our fourth concern. So I'm giving you the concerns not in the order that they should be. I'm just telling you what the concerns are. We're going to be concerned about dehydration. So anyway, we're going to have that head of the bed elevated because we're going to want to decrease that risk of facial and tracheal edema. Tracheal edema, they can't breathe, right? You guys following me? Okay. Post-mastectomy. Your patient just had a mastectomy. How are you going to position them? Semi-Fowlers with the affected arm elevated, prone with the affected arm lowered, side lying with the affected arm elevated, or Sims with the affected arm lowered. After your patient's had a mastectomy, how are you going to position them? If you were not able to join the Kahoot, that's fine. Just put in your answer on the live. I see a lot of question marks. Wow, only 39 of you guys got the right answer. You said semi-Fowlers with the affected arm elevated. A lot of you said sideline with the affected arm elevated. You're going to have that patient semi-Fowlers um, with the affected arm elevated. And here's why. You want the head of the bed to be at least at a 30-degree angle. You want to promote drainage. Okay, so that's why you're going to do that. You want it at least to be 30 degrees elevated. A couple guys, I don't do co-hosts on Kahoots. So a couple things you also need to keep in mind because these are famous test questions when it comes to mastectomy. So I'm just going to throw that in there so you can know. Please stop asking. I don't do co-hosts during Kahoots. Um, a couple things that you need to know. A patient post-mastectomy, they cannot get any in. All right. This is so embarrassing. Okay, post-mastectomy. What was I talking about? Okay, after patients had a mastectomy, under no circumstances can they get injections in that affected arm where they, on the side, I should say. So if they had a mastectomy on the left breast, no injections on that left arm, no blood pressure checks, nothing, absolutely nothing. You got to remember, guys, there's lymphatic tissue drainage, right? And that's why after a patient has a mastectomy, you want that arm to be elevated. We want to drain all that lymphatic tissue. Matter of fact, you're going to place like a small pillow, or you can take a towel and roll it up and put it right under that side to apply pressure. But we really want to promote drainage from that side, okay? All right, let's do the next question. Okay, which placement should be avoided after a craniotomy? Patient just had a craniotomy. What are you going to avoid doing? Is it positioning them on the unaffected side, elevating the head of the bed 30 to 45 degrees, placing the head in the midline position, or maintaining hip flexion? Which placement should be avoided? The code to get in is 318779. Can you guys type that in the live, please? 318779. Thank you. Wow. So let's talk about this. 23 of you said after craniotomy, what you should not do under any circumstances is place the head midline. Okay, let's talk about this. The correct answer is maintain hip flexion. Only 11 of you guys chose. So I'm going to walk you guys through this. A patient just had a craniotomy. Otomy, not ectomy. Ectomy is removal of. Otomy is to go into. So there's been a surgical procedure where there's been insertion. Something has gone into the brain, right? And my question to you is after that procedure, what are we going to avoid doing? Whenever you see a question talking about anything that has to do with brain surgery, head surgery, you're always going to be concerned about increased intracranial pressure. That's going to be one of your top concerns. Increased intracranial pressure, seizures, a couple other things, but ICP's on top of your list, right? So you're going to avoid doing anything that can increase the risk of ICP, such as what? Hip flexion, neck flexion, coughing, sneezing, turning your head to the side, or flexing your head this way. All of those things can cause what? Increased intracranial pressure. We want to do things to decrease intracranial pressure while we're increasing the drainage, right? We want to facilitate drainage. So what we do want to do is, you see what's in red? Position on the unaffected side? Yeah. Imagine that patient had a craniotomy on their left side. We're not going to position them on their left side. We're going to position them on their right side. We don't want to disturb that surgical site. So we don't want to avoid doing that. Yes, we want to position them on the unaffected site. There's nothing wrong with that. Let's look at the next option. Elevating the head of the bed 30 to 45 degrees. We want to do that. We want to facilitate drainage. We don't want that patient to get increased intracranial pressure. So we wouldn't avoid doing that. That's something we want to do. So we're not going to choose that. Placing the head midline. We want to do that. Why? We don't want the patient to get increased intracranial pressure. What do I mean when I say midline? Straight. We don't want the head like this. 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 All of those positions can increase intracranial pressure. We want the head in a neutral position midline. So we wouldn't avoid doing that. So we're not going to choose that. But maintaining hip flexion, guess what increases ICP? Hip flexion, head extension, rotation, coughing, sneezing. Don't play. So all of those things that would increase intracranial pressure, we're not doing. Are you guys with me on the live? The timer's moving too quickly. I'm sorry. I'll give you guys more time on the next Kahoot. That's my fault. I usually give you guys 45 seconds, but I felt like these questions were so easy, I gave you less time. I'll give you more time next time. So the correct answer is maintaining hip flexion because the question is which placement should be avoided after a craniotomy? What is hip flexion? So hip flexion is basically if the patient's knees is coming up to their face, their hips are being flexed. We don't want their knees going up to their face. That increases intracranial pressure. We want their knees down flat. Okay? Okay, a patient's post-op laminectomy and needs to be moved from one side of the bed to the other. How many nurses is this going to take? At least one, two, three, or four. A patient is post-op laminectomy and they need to be moved from one side of the bed to another. At least how many nurses would this take? Very good. Two. At least two. Why? Because if this patient had a laminectomy, remember, I think two slides over, I told you when something ends in ectomy, that means removal of, right? So they've had a portion of that spine removed, right? If they've had a laminectomy, well, we can't have any twisting or turning motions of that spine. That spine has to remain straight. It has to remain in alignment. So we can't have any of this going on. So that means if that patient has to be moved, they have to be moved gently, but they have to be moved as one unit. So it's going to take two nurses One at the top, one at the bottom, making sure that that patient moves what? As one unit. What is this known as? Very good, Des. I see you. Log rolling. That's what it's called. In order to log roll a patient, any patient who's had a laminectomy, I'm telling you right now, they have to be log rolled. It takes at least two nurses. Very good. Post-cardiac cath with femoral access, how long should the patient maintain bed rest? So the patient has had a cardiac cath with a femoral access. How long do you have to keep them on bed rest? 1 to 2 hours, 2 to 3 hours, 3 to 4 hours, or 4 to 5 hours? What do you think? 3 to 4 hours, guys. 3 to 4 hours. So, post cardiac cath, that affected leg, because it says femoral access, so the affected leg has to be kept straight. And you're going to elevate that bed no more than 30 degrees. Head of bed, elevation no more than 30 degrees, and affected leg has to be kept straight. And you're going to maintain that patient on bed rest 3 to 4 hours. One more thing I'll say to you before I move on to the next screen. This one we happen to be talking about cardiac cath, but any surgery that the patient has, if it was invasive, you're always going to be concerned about infection because it was invasive, right? So that surgeon going into that patient's body could introduce pathogens. You're going to be concerned about infection. You're going to be concerned about DVT or pulmonary embolism. Patient developing a DVT from lying down on that surgical table for so long, you don't move, blood slows down. Blood slows down, blood starts to pool, blood starts to pool, blood starts to what? Clot. God forbid that clot dislodges. Where's it going to go? To that pulmonary artery. Now you got a bigger problem on your hand, pulmonary embolism. Third thing we're going to be concerned about. What is the third thing? Surgery. Infection, DVT, PE. Oh, hemorrhage. That patient may be bleeding to death internally. So you're going to be watching for signs and symptoms of hemorrhage. You're going to be looking at the blood pressure. Is that blood pressure going down? Is that heart rate going up? What's the color of the patient? Are they turning pale? Those signs and symptoms of hemorrhage, you better be paying close attention. You're looking at the labs. Is RBC going down? What's happening with the H and H? Okay? All right. Your patient has a respiratory issue. I don't care what it is. CHF, asthma, cystic fibrosis, whatever. If they have a respiratory condition, what position are you expected to place that patient in? High Fowlers, Sims, prone, or low Fowlers? If you guys have been following me for any amount of time, you know the answer. Brittany, I'm going to choke you. Very good. High Fowler's position. Anytime the patient has any issues with breathing, the reason you're putting them in high Fowler's position is, well, for a couple of reasons. But number one, it's going to make it easier for them to breathe. You sit them up, their abdominal mass, the fat that's just pushing up against the lungs, it's not pushing up against the lungs anymore because they're sitting up. So it's going to make it easier for them to breathe. That diaphragm that's been pushed up against the lungs, it allows that diaphragm to be pushed down so the lungs can do what? Expand, right? So whenever you have a question about a patient having difficulty breathing, what are you going to do first? And it's you guys get tricked by this all the time. You'll see oxygen and you run to oxygen first before you sit the patient up. But I want you to think about it. Was oxygen the problem? Sometimes it is, but sometimes it's not. But guess what? If you choose oxygen first, you give that patient oxygen, but they're still lying down flat. Yes, you gave them oxygen, but where's the oxygen moving to? They still have all this fat that's pushed up against their lungs. They still have the diaphragm pushed up against the lungs. You're giving them oxygen, but the oxygen's not even moving. But you sit them up immediately, that helps them start to breathe. You're going to sit them up first, then you give them oxygen. Did I clear that up for you guys? Okay. True or false? After liver biopsy, the patient should be placed on their right side. Is this true or is this false? After liver biopsy, the patient should be placed on their right side. Is this true or is this false? Oh my gosh, look how close this was. Only 34 of you guys chose the correct answer. This is true. I want you to think about the liver. Do you know how bloody of an organ the liver is? Where are your clotting factors made? The clotting factors, those things that keep you from bleeding out. They're made in the liver, duh. So, yes, you're going to want to place the patient on their right side. You want to put pressure on that liver. Otherwise, that patient's going to bleed to death. Very vascular. Absolutely. Absolutely. Okay, for an NG tube insertion, the patient will be placed in high Fowler's position with the head tilted back, to the left, to the right, or forward. We're talking about NG tube insertion. We know that we're going to place that patient high Fowler's, but what are we going to do with the head? What do you guys think? Very good. Very, very good. That head is going to be tilted forward. Why? Tilting that head forward is going to help to close the trachea and open up the what? Esophagus. Very good. True or false? Trendelenburg's is a good position for the patient getting postural drainage. Is this true or is this false? Don't give up, Columbia. Oh, you guys are playing games on this live. All right. We're going to have to talk about this. True. Only 18 of you guys said true, and everybody on the live was saying false, 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 false. True. There are very few times we're going to use Trendelenburg position. This is one of them. Okay. When it comes to Trendelenburg, something you need to keep in mind when it comes to postural drainage, we want the part of the lung that's actually being drained, we want that in the uppermost position. And so that's why normally Trendelenburg is the best position for that. Okay. True or false? Trendelenburg is a good position for the patient getting a thoracentesis. True or false? This is the last question. Trendelenburg is a good position for the patient getting a thoracentesis. Is this true or is this false? False. Very good. False. Think about it, guys. Patients getting a thoracentesis, what's the best position? They're going to be sitting on the edge of the bed with their arm over that, what's that table called? Is it called an overbed table? Ugh, I can't think, but you know what I'm talking about. That their arms are going to be over that table so they can get that fluid out, right? Either that or that patient's going to be on, by the way, if they're sitting on the edge of the bed with their arm over that over I think it's called overbed table, but whatever, with that arm like this over that table, their feet's going to be supported by like a stool, right? If the patient's not positioned that way, the second way they're going to be positioned, they're going to be in the bed on the unaffected side. The head of the bed's going to be elevated to a 45-degree angle. So they're going to be at like a Fowler's position. Those are the two positions. Yes, tripod position. Those are the two positions that you expect one or the other, you expect that patient to be in for thoracentesis. And guys, that is it for this Kahoot. If you guys would like to see another Kahoot on more different positions and the diagnoses or the surgical procedures, post-op positions that go with them, just go ahead and let me know. This video will be up on YouTube in about an hour, so you guys can let me know in the comment section. I have absolute no problem. I'll make a second one for you. If you'd like me to do a Kahoot on a completely different subject, go ahead and let me know in the comment section, and I will try my best to accommodate. So let's see how you guys did.